A virus has sparked up in the Wuhan province in China. It already is spread to many places around China, such as Korea, Japan, Vietnam, Europe, Australia, and as well as the US and Canada. As of Thursday, January 30th, the total number of reported infected was around 7,818 and about 170 deaths. This number is expected to increase with each passing day. Many people don't know the exact classification of this virus strand since it usually is not seen in humans. As described by the World Health Organization, this virus is in the coronavirus family. This is a family of single-stranded RNA that usually reside in animals. These animals include your common house pets, farm animals, wildlife, bats, and pretty much any mammal, even including humans. It can also be transmitted from fish and other consumable purchases in markets such as the ones in Wuhan where various foods are traded and sold non-stop throughout the day. It is an airborne virus, meaning that it spreads through saliva, air, and objects if an infected person interacts with it. Symptoms include pneumonia, fever, cough, and difficulty breathing. Worst case scenarios include severe acute respiratory syndrome, or SARS for short, kidney failure, and even death. These symptoms apply to all who contract the coronavirus, but is particularly more deadly to the elderly or those who have previously or currently have medical problems. World Health Organization, doctors, nurses, and any medical personnel will recommend keeping contact a minimum in potentially contaminated areas such as Wuhan, Japan, parts of the US, and other countries with reported cases. They also recommend wearing face masks in crowded areas and overall avoiding mass public gatherings or transport of any kind. It is quite important, pretty much vital, for it to have been discovered and publicly announced as early as this virus was. The later a virus is discovered and announced, the more opportunity it has to spread and evolve. For example, the SARS outbreak back in 2003. The first case was discovered on November 16, 2002. China was aware but discouraged press from reporting on the outbreak. The Republic later notified the World Health Organization about the outbreak in February 2003. During the entire period of SARS, it had about 8,098 reported cases and 774 deaths. This was over a period of 6 months and infected about 24 countries all over the world. With this short description of the SARS outbreak, it's easy to see the similarities between these two viruses. After all, they are in the same family. Like all living organisms, a virus can evolve and mutate to benefit its survival and infectivity. This could explain the increase in infectivity but decrease in lethality of this newer coronavirus. There isn't any need to freak out over this virus due to a few reasons. The World Health Organization was notified extremely early, so the world can put focus and research into making a viable cure. Cities across the world have regulated and restricted accessibility and issuing bans on certain things such as transportation or selling in markets to reduce the spread of the virus. These are the necessary steps in quarantine in order to efficiently research and find a cure for the virus. The current fatality percentage for the coronavirus is about 3%, which could decrease with proper care and procedures for the sick. It could also increase with improper care and possible evolution or mutation and spread of the coronavirus. The world has its eyes on this new virus, and it won't look away. This has been George Starr for Code Blue News. Back to you in the studio.